Sponsored by Akron Children's Hospital.
Well, we all know it's a season for allergies and flus and different things like that, but what if your child's breathing is off? You want to make sure that everything is okay. There's something out there called RSV, and Joe went to talk to someone, and here you can learn all about it. Take a look.
Yes, here we are at Akron Children's Hospital with nurse practitioner Blair Mayfield. Blair, we're talking about 3 letters today, RSV.
Yes.
What is it?
RSV is simply a virus that affects young children and adults alike. It just is worse in young children. So it's something that we worry about here as we enter flu season, and just something we really want to bring awareness about to our viewers.
Where does RSV happen on the body?
Yeah, so it's an upper respiratory infection, and it affects the elderly and the babies the worst, and then that can transpire into bronchiolitis or pneumonia, and then that can be affected by the lungs.
Well, here at Akron Children's Hospital, let's focus on the little ones right now. It can be very dangerous, right?
It can be, yes. And so we really want to bring awareness to those. Just being cautious if you have a young child, an immunocompromised child, or really being around the elderly, just being really cautious about the spread of RSV.
Is there a time of year where RSV becomes more susceptible?
Yeah, in our region, it really is the worst between fall and winter seasons. And so we just really need to practice good hand washing and be aware that it's out there.
Blair, what should we look for in our little ones to find out if this is turning into RSV?
Yeah, so an increased work of breathing is always a concern, but it typically presents just as your common cold. So a cough, runny nose, maybe a little bit of fatigue, but then it can progress and then cause difficulty breathing, change in breathing, and that's when we really become concerned.
I know there's a lot of things that we can get as any age, but as children, there are things that we should look out for. What's the difference between RSV and like croup?
Yeah, so croup has a different cough. The croup cough is that barky, harsh cough, worse at night, also caused by a virus. But the RSV, we really are looking for that increased work of breathing, pulling when they breathe, head bobbing, nasal flaring, really working hard to breathe, not eating well, not drinking well, just really kind of out of it. And that's when we were really concerned.
You mentioned it's contagious.
It is.
So what do we do? You mentioned washing hands and making sure you're using hand sanitizer, but how is it transmitted?
So it is a droplet transmission.
Okay,
so,
what does that mean exactly?
So from your respiratory droplets, so from your mouth, your eyes, your nose. So really avoiding touching those, covering your cough, covering your sneeze, masking up, not going out if you're sick, not kissing a baby, touching their hands after you've touched your face, being really cautious about that transmission.
What do we start with? Where should we say it's getting serious?
Yeah,
it's time to go in.
So it starts with just an upper respiratory infection seeming. Cough, runny nose, just maybe it's just a little fatigue. And then it progresses. By day 3 to 5 is the worst of it. So by day 3 to 5, then we would say you should be seeing it worsen. That would be an increased work of breathing, cough. We definitely want to see you then. Any color change.
When we come to Akron Children's, how's it treated? What do we do?
So we would diagnose it by doing a respiratory swab. So similar to the COVID test, up the nose, and then send it for swab. There's no treatment, there's no vaccine yet for it. It's all supportive care. So suctioning, good hydration, and rest. If it does progress and worsen into a bronchiolitis or pneumonia, they may need to be hospitalized and get IV fluids or oxygen. But that's what we try to avoid with our, symptom-based management of the suctioning, rest, and hydration.
How long will RSV last? I mean, could it linger?
Yeah, so it can linger. The worst of it, as I said, is day 3 to 5, but it can last up to 7 to 14 days, and coughs persist. So even if the other symptoms go away, your cough can last a little bit longer.
And wash those hands.
Wash your hands.
And don't touch your face if you're starting to feel sick.
Exactly.
Thank you so much. For more information, akronchildrens.org is the website. Blair, thanks for all that you do.
Thank you so much.
You bet.
The October